welcome everyone. So today we have Dr. Abigail Hirsch and Shannon Dougherty will be leading the conversation, and just wanted to give a little heads up around the Q&A and the chat. So feel free to send our team messages in the chat. We will be responding live. We have a few of us here ready to go. And do send questions and throughout the presentation. We will answer some of those via chat and then pass over questions to our presenters as well. And please, as you send questions, we love to know where you're from and your name so we can address you personally. And we'll keep our lines open for questions after the webinar concludes as well. And do know that while we can't answer every personal question live, if you'd like to have a follow-up with a member of our team, we'll be available on the phones. So yeah, looking forward to hearing your questions on the presentation.
And with that, I think we're going to kick in. And what I'm going to do is actually turn off our share here and just be able to have a conversation with Shannon. Give me 1 second while I do the little bit of moving stuff magic. So Shannon, before we talk, I'll introduce myself a little, then maybe you can introduce yourself too. So I'm Abigail Hirsch. I'm a clinical psychologist by training and a co-founder here at Lynn Health. And I just feel incredibly, incredibly fortunate to be able to be running a company that every day I get to see stories of people turning their lives around, getting their lives back, reclaiming days, weeks, months, and years from pain. And so we're really glad that you're here to learn a little bit more about what's really the foundational aspect of our work at Lynn, which is helping people to get the right diagnosis and why that matters. And Shannon is here. Shannon is a coach for us at Lynn, but also has an incredible personal story of a 17-year journey from fibromyalgia and a whole bunch of other symptoms and diagnoses, which we'll talk some about, to today being basically pain-free and one of our incredibly inspiring coaches. And so Shannon, amazing to have you here. And before we kind of get to your story, I just love to let's start with the punchline. I'm one of those people who likes to read the last page of the book at the beginning. So what is the most important thing you want people to take from our conversation today?
So the most important thing, and honestly, it's so exciting for me because it's something that I've wanted to say for decades now. It's that chronic pain is curable and that it can get better. And when I was a pain patient and looking for answers, that wasn't talked about. It seemed a bit taboo. And that the possibility that there is another side and that it's not something you just have to manage and put up with for the rest of your life. No matter, from my own personal experience, like how bad it was for me, and now to be on the other side of it, to be able to tell people that it can get better and that chronic pain doesn't have to be the end all be all. And the thing that dictates what's going on in your life, like it was for me for so long.
Amazing. So I really hope that people all kind of hear that message of hope. It's certainly core to what we do at Lynn, but now let's flip to the other side. Let's talk a little bit about the reality of what it's like to be coping with pain and a pain journey. And maybe you can just start telling us a little bit of your story, how your pain started and where it went.
Sure. Yeah. So I started having headaches in, middle school, and then they kept getting progressively worse and worse to where I ended up having a headache every day. And I also had mono. I had Epstein-Barr when I was 15, and my body just never really fully recovered from that. I was on prescription painkillers all throughout high school. And then that morphed into other drugs and things as well, all prescription, all from my doctor, just trying to help and help fix the symptoms that I was having. Eventually I got to a point of, those are all of my old symptoms.
And I was just going to say, speaking of symptoms, and I'm smiling and laughing now because I know the outcome of the story, and we all know the outcome of the story. This is a big list.
It's a very big list, and they didn't all come on at once. But things that are on there, things that were considered incurable. But I just kept pushing, kept trying. I had an immune deficiency where I would have to get an IVIG every 4 weeks, 3 hours hooked up to an IV just so that my immune system wouldn't freak out. I was sick all of the time. Sinus infections, bronchitis, pneumonia, it was like clockwork. And so now I haven't had a sinus infection in like 8 years. I maybe had one cold last summer, and like that was about it. And trigeminal neuralgia, anxiety, allergies. I was at a point where I couldn't eat anything but rice for probably 4 months, if not longer, because everything gave me symptoms and I reacted to everything. And that took a long time. I honestly, the food allergy aspect of things was so confusing and so scary. But now I'm eating everything and I'm on the other side of it. And it's just like finding out that it's possible was part of my healing as well. But yeah, at 19, I was on 19 pills a day, all prescription, and different things. And I decided that I didn't really want that to be how things were, because there wasn't an end in sight that way, right?
Shannon, I absolutely, first of all, and I think it's really, really important. Like, and part of the reason I wanted to kind of put the symptom list up for people to see, but I'm gonna like put it down now for a minute because it's an overwhelming list to experience. Just even looking at it is overwhelming. But it's really striking to me, and I think really surprising for a lot of people, that pain is often not just what we think of pain, right? We talk about pain and we think about like back pain, but your description like of your nasal infections, et cetera, that there can be many, many, many more symptoms or things that look like food allergies that actually go with pain. And so this is, again, why this diagnostic piece is so, so important, right? Because what I'm sure you were hearing from most docs was something like, you have the lemon of a body and you have a million different things wrong with you. And that's why we're putting you on 19 pills. Does that kind of resonate for you?
Yeah, absolutely. And I mean, I went to Mayo Clinic and I was in that system and I saw 10 different specialists with my mom, and we just went from building to building, office to office, trying to figure out what was wrong. And the really cool thing about a primary pain diagnosis is that it's an umbrella for all of the things that I was dealing with. And so, that really helped me shift in how I approached my symptoms. And so that's really what I would want to help somebody here today is knowing that there is a different diagnosis that maybe is curable, but you can get better.
So Shannon, you mentioned primary pain as a diagnosis, and maybe I'll just, I'm gonna pause for a minute and just explain a little bit what that is, and then I want to kind of loop back around and hear some about how you got to that diagnosis, or that understanding of that diagnosis. So primary pain is a new diagnostic category that actually just came out in codes that World Health Organization every 10 years or so kind of does an upgrade of how we diagnose disorders and illness and diseases and symptoms. And so the latest update just went live in January 2022. And in the world of pain, there's just been this sea change that's reflected in those new codes, that we now have something called primary pain. And primary pain is an acknowledgement that for people, all of us that have pain, long-term pain experiences, in many, 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 many cases, it's not actually that you have a lemon of a body or 27 different symptoms that need to take it. Your description is so nice that you need to spend a week walking with your mom from office to office to office at Mayo Clinic. But that there's really one core thing that's wrong, and that's this primary pain. Some people call it a disease, some people call it a disorder, but it's certainly a chronic condition, or can be. And primary pain basically, just at a super high level, means that what is broken is actually often not one's body in the vast majority of primary pain cases. People's bodies are actually okay, although they don't feel okay. And Shannon, your description is so clear about that. But what the core disorder is in primary pain is actually a signal processing disorder of pain signals. And so I just first want to say all pain is real, and the suffering that, Shannon, you went through, and that I'm sure everybody on the webinar, is coping with, is really, really, really real. It's just that the source of that over time, and there's incredible MRI studies, and we have other webinars on this topic if people are interested, but basically over time, what happens is when you've had, for example, an illness that was kind of scary, the pain signaling system in your neural circuits in your brain can get turned on, and they just get kind of stuck in on mode. It's like a car where the check engine light is stuck on even once the engine has been fixed. And so we can experience very real, very intense, all kinds of symptoms when the source of those symptoms is really one thing, not all these different symptom experiences, which is a signal processing misfire or disorder starting from our brain and neural circuits. But with that, Shannon, I would love to hear a little bit more from you about when you were looking. There wasn't this diagnosis, right? But I believe you did find someone somewhere along your journey that helped give you a different way to think about things. Can you share a little bit about that?
Absolutely. And I also really want to validate everyone who's watching and having symptoms. Like, I had such incredible pain. It was real. Like, I could not take a shower for a year because the pressure, the water pressure hurt too much. And that was a real symptom. But that doesn't mean that it wasn't also part of like a brain processing, just like processing a sensation as dangerous or triggering pain where there didn't need to be some. And so by working through that, my pain signals were able to turn back down. And I found I just always was researching and trying new things. And Abigail, I think I have a slide.
Yeah,
I think that
we want another incredible list here.
And it's very overwhelming, folks. So like, don't feel like you need to read all of these, but some honorable mentions. I saw an angel healer. I did hula hooping. I wore a silver ion totosis machine.
What is hula hooping? I don't even know what it is.
No, hula hoop, like you're literally like you did when you were a kid with the hula hoop around. Like that was one of the things that I tried in order to help my lymphatic system so that I could feel better. I went with one of my myofascial massage therapists. And so like when you are in pain and you are having so many problems, I think of my members as a pain coach, like they're the most determined people that I know. And like, that was one of the things that one of my physicians helped me with. His name's Dr. Brian Lum. And he told me, he was like, you're not desperate, you're determined, because I just felt so desperate to feel better. And I was trying all of these things that were so outside my wheelhouse, coming from like, my mom has a nursing background and I'm all very science-based, but I just wanted to feel better. And I know so many other people want that too. And I want to pass that along from like that wonderful Dr. Lum, who told me like, you're not desperate, you're determined. And that's what I think of all of the people experiencing chronic pain that I've met. They're some of the most determined and incredible and kind people in the world. And like, I just want to help them get better,
So Shannon, I just want to go back to your list, because I do see it in the list. Anybody who's willing, to just keep at trying and with everything that didn't work, regrouping and finding their hope again and trying the next thing. And some of these things are hard. Like, I know the list isn't up on here, but you did like juice cleansing and fasting. Like, those take a lot of willpower. Never mind it being, at least for me, not fun experiences to not eat for extended periods. But I'd love to hear a little bit more about, just what that journey was like for you each time you try something, and then, you tried something and it didn't really help. What were some of the least helpful things you came across in your experience doing them?
Totally. And Abigail, that brings me to another point of this like hope disappointment cycle that a lot of pain patients get in, because so many people have offered, oh, this is the thing to help you. This will do this, that will, so many false promises. And maybe they have helped other people, but it just never worked for me. And I mean, I had a friend tell me, I remember calling her at like 3 a.m. and she's in Switzerland. So, you know, like time zone difference, but I could not sleep. I was so afraid of what the sensations were happening in my body. Literally each body system I could feel shutting down. My stomach had stopped working. I had gastroparesis. I couldn't sleep, all of these things. And she told me, she's like, you cry and you don't believe that you can get better right now because I'm going to hold that hope for you. And that was so incredible to have somebody tell me that I could break down and I could be upset, but that they would hold hope for me. Ooh. And so that's what I see like my role as a coach for folks. And I like pass on that gift that she gave me, because I really do believe that it's possible. And like I say, I'm going to hold the hope torch for you until you can take it on. But yeah, people like
I want to just underscore that, you know, because look, we are going to talk some about Lynn Health and what we do here, and you're already wonderfully sharing some what you do as a coach. And I think it's really important to just like pause for a second and say that, you know, on the one hand, we're very cognizant of, you know, being a program that is based on the latest neuroscience and that is based on clinical research that shows its efficacy, but also wanting to, you know, acknowledge that getting up your hope again can be really scary and overwhelming. And that is why I love what you said, that we really see our coach's role is to hold the hope, and your job is to kind of step in the door. You know, again, be willing to step in the door again and really try to do something a little bit different. You know, on that side of hope, the kind of theme of hope, one of the things I think that, you know, makes it so hard to get that like hope disappointment cycle not spinning is because we often hear things about pain that are incredibly discouraging. And I know you have some doozies you've heard. I've heard them over the time that I've known you, but would love some of your thoughts on what are some of the, you know, kind of least helpful things that you came across or heard from people about pain and about what you should do about it.
Absolutely. And like I have been through a lot of that, and I know a lot of other folks have as well. And so by sharing my experience and the things that I heard, I hope it can help validate what you've felt and been through as well. And like, don't get me wrong, I love doctors. I think they're incredible, but sometimes they don't have the best way to explain things. And I've had doctors tell me, oh, it's all in your head. I went to a really well-known neurologist, pardon me. I came home from college to see him. I went with my mom in the room with me, and they just told me, you're just drug seeking, and that that they weren't going to prescribe me anything. And that was the last thing that I wanted. I had already gotten myself off of opioids because I'd been prescribed 5 a day by a well-meaning rheumatologist at the time. And, you know, like I didn't want drugs. I just wanted someone to help me find an answer. And that was really hard to hear and really embarrassing, because it felt like, you know, going through all of that and not having someone support you or help you get where you want to go and judge you for the things that you're doing. You know, I was promised and told that it was my diet, that it was, you know, the gut bacteria, that it was, you know, an invisible illness, an invisible virus eating away at my muscle fibers. I was told so many unhelpful, scary things. And that's one of the reasons why when I found this approach to pain, it just felt like an albatross had lifted, that, wow, there's a different way of looking at this. And it's not that I'm broken or that I'm got something wrong with my depression and anxiety and pain. Like, it's a completely curable and normal brain process that everyone goes through.
I just want to ask you to talk about a couple other ones we hear all the time. What about around exercise? Did you ever hear anything around exercise?
Oh yeah, I had like one, you just need to exercise more, and two, you need to stop exercising because like like so what are you supposed to do with that? Right? Or like the movements you are doing are causing the problem. And now you and I know, and the science tells us that that's not always the case. And more often than not, it's not the case.
No.
Yeah.
What about more big picture ones like, you just drew the crappy stick, excuse my language.
Yes. Okay. So I was told that it was part of my karma and that was why I was here. Because you saw, maybe you didn't see, but in that list, I saw shamans, I saw intuitives, I tried everything. This was after all the Western medicine stuff, guys. I wasn't just like really into that from the get-go. It was just a lack of options. And so, to be told like this was something, one of the worst things was actually that you'd have to accept it. And like acceptance to me felt like giving up. And, that was really hard because it was like, well, I don't want this to be my life. If that was, like you get in these really dark places if you think that pain is going to be around forever, and so that was really tough too. But yeah, a lot of intuitives told me that it was my karma and that was just what I had to deal with.
I'm very glad that your karma turned out that you did get to life dealing with pain, but it's with being privileged to help other people take out of pain instead of dealing with your own pain.
Absolutely. And I think that's what was so important for me and like kept me going was that I just kept telling myself that I was going to figure it out and that this wasn't going to be my story and that my story was going to be to help hopefully millions of other people one day, get better too, because it is possible. Yeah.
You're helping do that every day here at Lynn. But so let's switch from talking about the not so helpful things that you were told over the years to what was really helpful. What are some of the most helpful things that you heard? And
yeah. So there's a great slide with from Dr. Shannon. Yeah. So this was one of the first things that I found in this realm of primary pain. And like I said, at the time, that wasn't the technical diagnosis, but it was on Dr. Howard Schubiner's website. And it's it was a way of looking at pain differently and that it wasn't in my head and I wasn't making it up. It was actually happening, but that there was another way around it. And that the diagnosis is that a word? Diagnoses, whatever. The many diagnoses that I had, they were incorrect. Maybe not incorrect, but they were under some other umbrella. And that, if the diagnosis is wrong, you can't get better because all of those diagnoses that I had were considered incurable and they didn't have a cause. And medicine didn't know what to do with and what to make of them. And so by looking at pain differently and finding another route, one that gave permission to get better and to heal and to cure from chronic pain, like that was a huge game changer for me. And I dove so hard into it.
Out of curiosity, to get to almost getting to that kind of a diagnosis, I'm curious just kind of who you went to see and what the costs are, in general to have a specialist sort out if you have pain.
It was a lot. I was, I've always been so determined. The amount of money that myself and my family have spent on this is insane. The jobs that I had to work in order to be able to do that. And, this is so tough for so many people, but I was determined. And, I saw a specialist in the field of mind-body medicine or what have you is kind of what it was called for, and it was almost $600 for my first initial appointment. And then, I saw therapists and different things. That was about $150 a session over 12 sessions, and I didn't get better. And then I joined a groups program, another, I don't know, I think it was like
Chunk of
13.
change.
Yeah, and so it is expensive, but that's why I love the work that we do here. It's like making it accessible. And like, I didn't actually get a diagnosis when I saw the specialist. He was super helpful, and like all the things that I mentioned helped me to get better. But now there's another route to do that. And like knowing, like if I were to have somebody, because I spent about 9 months just on my own trying to figure it out and researching and learning and teaching myself. But if I had somebody else that would have been like, yeah, all of these symptoms, you have primary pain, and this is how you get better, it would save me a lot of time. But I know that I had to go through that in order to get where I am now. So.
And my hope is that fewer and fewer people ever have to go through it, because we do know today what primary pain looks like, how to screen for it. It's part of why it's really important to us at Lynn to have, really accessible, affordable ability to get those consultations and at least understand, is this, is your pain presenting in a way that's consistent with what we know today to be primary pain? Hey, let's go back to the happy side for a minute here. So what finally helped you? And I'll just put up kind of some notes that you had made for us, but give us a little summary of what turned the corner.
Really, it was knowing that it could be cured. Like I had always hoped and believed that in my heart. And, there were some dark days where I didn't, but there was still a little fire burning inside that. But like finding out that other people had cured themselves of similar things that I had, and figuring that out was huge. So like I said, a different way of looking at pain, that all pain is actually processed and created in the brain. And so what if we could calm the nervous system and then also calm down the pain signals? That really resonated for me, because I kind of knew like my nervous system was on high alert. I had sound sensitivity, smell, chemical sensitivity, all sorts of things like that as well. And so, yeah, like brain training, the nervous system, that was super helpful.
And of course, today we know that is really the evidence-based treatment for primary pain, is that we do have to get that, check engine light that's stuck on, calm down, and that there are some really specific techniques that help people. Again, different people respond best to slightly different flavors in the techniques, but there is a really, really nice, established, with great research behind it, now knowing about how to do that. Which is, again, what your members are so lucky to have you doing with them every day. You have in here also, just tell me a little bit more about why it was so, or memories you have from hearing that it was possible to heal and that others had done this, that this is yes, pain can be a chronic condition, but it doesn't have to be a life sentence.
And it was really helpful to hear what others had tried and done, and like utilize that for my own experience. And that's what I think is so cool about the coaching that I do. It's like, oh, I get to utilize all of the things that I tried to help my members as well. And one of the things, like I went on a walk one day and I could just feel my body doing the same thing that it did before, because a few years ago, I was living at my parents' house and I could maybe walk 2 houses down the block before I had to turn around. And that was really hard as a young woman to go through something like that and feel so old and like have so much pain in my body. And I felt that again. I was living on my own at this point, but I started going on a walk, and within crossing the street, I felt like I had to turn around, but I had been learning and listening and researching all of the science and hearing the recovery stories. And I just decided, okay, I'm going to just, with each step, I would say, I can do this. I can do this. And I know that sounds so silly, but I was able to go on. My walk was going to be 15 minutes. That was my goal. I went on a 45-minute walk. I had so much fun. I basically said that to myself, at least for the first 30 minutes. But I just kept challenging what was possible for me. And my brain was then feeling safe enough to do that and not have a rebound effect afterwards, because I proved to myself that I could. And so that was one of the stories that I like to give people, because
Love it. And it's great.
you can kind of change what's possible for you.
Yep. And again, I'm sure, on your journey would have felt so much easier again if you'd been able to just hear really clearly, you have primary pain, this is reversible, and then had someone along your side instead of you're having to kind of stumble into what worked. Someone along your side really helping you to have the hope and a systematic approach to relearning those pain firing patterns. So I love this slide. Just again, we've cut to we've said some about how pain is curable, but what I love about this slide is that you now are able to say some of these are a strength rather than a weakness. Tell me a little bit about that.
Yeah, absolutely. So, I was able to get rid of most of all of my symptoms. And then, now, my jaw still deviates and does weird things, but it doesn't hurt. And the ADD, ADHD, that gives me more creativity, and I'm very quick and fast on my feet. And, my members will tell you I'm very creative with the metaphors and the analogies that come up when we're working together. And so it's like, well, that doesn't have to be something wrong with me. It can be a way that I utilize. And, you and I were talking about using symptoms as kind of a guide. And so now when I have symptoms come up, because I used to be nauseous 24/7, honestly, it was a really big problem. And within the last couple of weeks, I've kind of noticed a little bit of the nausea creeping back in. Like before the webinar today, I was having that for about 30 minutes. And then I was like, oh, this is just because I'm nervous and I'm doing something I've not done before, sharing something so personal, but hopefully helping people in the process as well. So now I use my symptoms, or, sometimes I still get a little bit of pain, and, it doesn't have to mean the whole world is ending the way that I used to, or that I was super broken and never going to get better. Yes, I love this slide. So this is what I do with my members and people. And it's like, instead of life is pain, if you ever type pain with your keyboard and the emojis, sometimes bread shows up. It's because pain in French is bread. And so it's life is pain au chocolat. And so you get to make your experience into a chocolate croissant instead, which is funny because I used to only be able to eat chocolate croissants after I got recovered from mono. That was all I ate for 3 weeks was pain au chocolat. So yeah, it's about rewriting our pain story and about what the pain means for each individual, and utilizing it as a guide sometimes, instead of as something so debilitating, and knowing that it can move and shift too.
Yeah, I have a son with a pain history, and again, I feel very, very grateful for the tools we use at Lynn, that they've been incredibly helpful for him. But we now talk about his kind of, when he gets a taste of pain coming back, it's his superpower, that it's really, again, in a deep and profound way for him. I think it's easy to hear some of this and be like, oh, that's just making light of it, but it's not. It's really it's a profound thing for him to have this early warning system that he knows is super sensitive and super attuned to when there's something a little stressful or fearful or scary in his world. And he can listen to that signal now and say, okay, body, I have the tools for how to calm you down so I don't let my neural circuits start signaling pain again. But I also can recognize that, it's nice to have a car that has a check engine light that turns on a little bit before, your oil runs out and you have a disaster on the side of the road.
You really get to know yourself a lot through this work as well. It's not that you didn't have self-awareness before, but the amount of the way that you can attend to yourself and is really beautiful. I see in a lot of my members and in myself too.
I'd love to know a little bit more on that front. Just, I hope people are curious about you. I'm curious now, and I don't know the answer to this. Tell me a little bit more. Just what are you doing now with all the hours that were going to pain before? What are you doing in your life?
Oh my
What are
goodness.
things you pick up?
Right. If we're looking at a pie chart, my pie chart was like 98% focusing on curing chronic pain and symptoms. And now it's much more balanced. I get to do so many more fun things. It's not always in the forefront of my brain, which I had to do a lot of work around to like remind myself that I didn't have to always be focusing on fixing something and that I could get better. But I sing, I do musicals. If you follow me on Instagram, you will see I dance like 5 nights a week at a local adult dance studio, which is fantastic. I hope that they have adult dance studios in every city in the US one day, or in the world. We could do that too. And it's so much fun. It's so joyful. And when I started going there last year, I did this really intensive cardio hip hop class, which it's very funny to see me do, but I'm getting better. And I just remember like, I was crying in the class, and I'm so glad at the time we still had to wear masks. And I was so overjoyed and impressed with myself that I could do that, because it was such a high intensity level that would have before sent me into a migraine. And so, yeah, I get to do that. Let's see, what else am I doing? I've started doing hot yoga. What? Like, I mean, I couldn't walk 2 houses down the block. It's amazing. And it's so fun to be able to enjoy my body. Because for so long I hated my body. Like I really did. It was something that I fought with every day because I could not understand the amount of pain that it was causing me. And I know a lot of people feel that way too. And so that idea that you can be friends with your body, there's this great quote that says, and I said to my body softly, I want to be your friend. And it whispered back, I have been waiting my whole life for this. And that's really where I feel like I am now.
Maybe that's a nice segue into some of the things that excite you about being a coach, about, some of the perspectives that you're able to, bring to members, and, just to give some background for people who are listening, the way Lynn works is first we help you get a diagnosis. Is this primary pain? Is this the kind of pain that Shannon had that has to do with learned neural circuits, totally real, but kind of firing in a way that's not being helpful and making all kinds of different reactions in our bodies. But the second piece of the process is working with our coaches, who kind of make it so that you don't have to discover all this on your own, but are taking you along the evidence base. So Shannon, tell me a few of the things that you most enjoy about being a coach, or the most enjoy sharing with your members.
It is so much fun. It's so incredible to see what they're capable of. I mean, and to have gone through it myself and then see other people also improve and get better. It's so incredibly validating, it's not about me, it's about them. But I definitely feel like this sense of, I'm just so impressed with them all of the time. And it's just really wonderful to offer someone a new way of looking at something and seeing that light come on and seeing their symptoms improve. And we don't just focus on pain. It's also, we can help like with anxiety. There's a member who completely cured herself from IBS, focusing mostly on anxiety and some of the other work that we do. It's just
really
incredible.
Shannon, I'm really glad you brought up anxiety, because it's something we haven't talked about yet, is how much other mood symptoms go with pain. Anxiety, depression, suicidal thinking, the feeling that I just don't want to be here anymore because this is so bad. I am curious, just for a second, were those ever parts of your experience?
Oh my gosh. Yeah. Most definitely. I mean, and the thing with that is it's a cycle, right? So like the anxiety happens, the pain happens, then more anxiety and then more pain. And it's just this horrible treadmill that you get stuck on. I had a lot of, I don't want to be here. It was never action oriented, but it was like, it would be nice to not be here all of the time. And those thoughts were so terrifying to me and so outside of the normal, what I thought was normal, but then going in and doing this work, those thoughts are normal. And actually it's okay. It's okay that you don't want to exist in pain for the rest of your life. And
But
that
you shouldn't
so
have
helpful.
to pain.
Yeah. Yeah. And those thoughts were so scary. And it to go through that alone was so hard. But there is another side of it. And yeah, this is the lovely, lovely Charlie Mackesy. What's the bravest thing you've ever said? Asked the boy. Help, said the horse. And that's really something I just admire with everybody who comes to Lynn or is even at this webinar and wondering if there's another way, and asking for help and knowing that you don't have to do it alone is what I wish I would have had, at when I was going through this. And I wasn't alone. I have an amazing family and wonderful support, and I'm very lucky, but to be in that pain by yourself is very hard. And so to be able to support a member through that is really beautiful.
Shannon, I think it's a lovely place for us to kind of start to transition over to Q&A is, just summarizing, pain does this, right? Pain does put us in dark places sometimes, and, make it a lot of things hard. But to know that there is this kind of pathway that starts by saying, I want to understand this. And that's why a diagnosis is so important, a proper diagnosis, and one that assesses to see if primary pain actually is, could be, part of what's going on, maybe your full story, or maybe a part of the story, but it's amplifying everything else and making it so that what could be a little bit of, like Shannon has still a little bit of sensations here and there, could could be brought back down. But after having a diagnosis, this piece of also saying, hey, I want to get on the horse. I want to ask for help. I want to go on this journey together. Again, on the one hand, using tools that the science are super clear about, that these are what help get people out of pain, but also having someone there with you day in and day out to, weather the inevitable flare-ups and to be a supporter. It's incredible gift that you give to our members, you and all of our coaches give to our members every day.
The coaches are amazing. I just want to say, like, the team that you've put together is incredible. Like, I can say I love everyone that I work with, and we're just so lucky that, we have weekly coaching meetings where we collaborate and we find ideas. Like, if ever a member feels stuck, like, and there, it's just a beautiful community, and there's so much support for everybody here at Lynn. So.
I love that you brought that up, that Lynn is truly, a community. We're a community within the organization, but also, with our members, that that it's not just your coach off on their own, somebody practicing, just doing their one thing, but you have the richness of, your coach and their peers and our medical and behavioral health and PT specialists behind them, that there's really this whole team there and pulling for you, some, more in the fore and some more in the background, but it's a really incredible thing to have that, instead of, again, what I'm so sorry. I'm so glad you got to where you got, Shannon, but I'm so sorry you had to do it without that team feeling behind you. All right, so I'm going to kind of
the other side of it. Abigail, I just want to tell people, like, that healing does not have to be hard. Like, so often that's what my expectation was, and that's what I went through. But working with them, it does not have to be difficult, and it does not have to hurt to heal. So that's
Actually, it can be fun.
yeah,
And
that's
that's
what I'm thinking
the
too.
important part of it is helping them find that fun. Absolutely. Okay, so we're gonna take some questions. And again, I just want to emphasize that we're really sorry if we don't get to your specific question. And our team has been working super hard to answer live, and we will loop back around. But we're really here to continue the discussion. Okay, so first piece, if you can give one piece of advice, what would you tell people other than don't give up?
Let's see. I mean, don't give up, like, keep going is always my other one, but that's kind of the same thing. But that, I guess, like, that you can change the way that your brain perceives pain, and that by calming your nervous system, and like you can make shifts and different things happen. So like, yes,
Yeah.
don't give up. Yes, keep going. You don't have to do it alone. These are all just little clips, but like really you can calm down those pain signals, and you can, and I guess that you can get better.
Yeah, I love to, if I'm going to add my favorite advice, it's that our bodies are incredible healing, like self-repair machines. They do a great job of that. And our brains are incredible learning machines. They learn how to do, you know, crazy things like recognizing everything we see all day and hear all day. And they do it by learning patterns. And so because our brains are so good at learning, sometimes they mislearn, but if something gets like pain gets mislearned, it can get unlearned. And it's just really a matter of having the right kind of practice and retraining. And we really can learn our way to very, very different experience. All right, here's the next one. If you can tell people one thing to try, what would it be?
I think I just said that with the nervous system work. Um, I would say one of my favorite things that I give usually in the very beginning is like this, yeah, the hand on heart, go through the same time. Because as Alan Gordon says, they did research, and with a hand on the heart activates the same part of the brain as if you're giving or getting a hug. And like really attending to yourself in that safe and calm manner, just taking a few deep breaths, like when you feel the symptoms get activated, and like giving yourself that compassion rather than, oh, why am I having this again? I'm so frustrated, or this is so unfair. It's a, oh, wow, you're having those symptoms again. This is really hard. And
You know, this for me also is one that I've just learned about as since founding Lynn. And it does, on the one hand, it feels so silly and such like this little gesture. And at the same time, you know, to just be able to say like, okay, I'm giving myself this hug. It's a piece that is so simple to do, and, you know, can get people one little step further forward and through one more piece. And give them the energy to keep doing the learning that it takes to get pain to turn around.
totally. And it bridges this gap of like, you know, sometimes when pain is really, really high, you don't want to be focusing on it. You want to be doing a little bit of distraction or whatever, but it's kind of like in the middle of just like attending to it, but with a lens of safety, but not diving so far into it where you start to spin, because that's what I used to do.
Yep. So maybe I'll read this one, and maybe I'll kind of take a first crack at it. I'm a breast cancer survivor, and I also have rheumatoid arthritis and fibromyalgia. I have a long list like Shannon's, migraine, stomach issues, spine pain, etc. Is there hope? I've been in some kind of pain since I was a teenager. So I'm gonna just like put a little bit of my like diagnostic hat on here, and say, your description is very hopeful, and there's a couple of things that really pop out. The first is describing yourself as a survivor, that pain, long-term pain can start without any kind of physical trauma, but definitely like in Shannon's story, when you've had a real medical emergency, and then you couple that with some kind of pain for many, many years, like since your teenage years, that's often a really, really good signal that you were kind of primed for chronic pain, primary pain, as a teenager, and then you had a stressful life event that just ooched up the volume on it. And then the last thing in your description that, again, is a good, I can't say for sure, but a good signal that you have primary pain, which means there really, really, really is hope, is that your list is long. It's so ironic that the shorter the list, the more we have to look carefully to see if this is primary pain. But when the symptom list starts to be all over, there's a principle called Occam's razor. I never say that right, but it's basically the idea in science that like one simple explanation is often a better way to go than a million complicated explanations. And same in the world of pain, right? When we see lots of symptoms, it makes us think like, well, could there be one underlying thing that's causing all of these? And so it's often a very good indicator that primary pain is what's going on there. Shannon, anything you want to add to that, or should I pull the next question?
You can go to the next question. I think that was perfect.
Great. I've tried many things, however, nothing seems to be working. I'm even scared to take some of the medications I've been prescribed. What can I do?
Oh my gosh, I have so much compassion for you because that was me for like 6 years. I decided that maybe all of the headaches started because I started taking thyroid medication around the same time and that I was allergic to the gluten in the thyroid medication. So I didn't treat my thyroid, my Hashimoto's, an autoimmune disorder, for 5 years. And so I totally understand where you're coming from. I don't know if you've had this happen, but I also had a lot of really bad reactions to drugs and medications, and had withdrawal and different things as well. And so I think working with your doctor and finding a way to feel safe when you're taking these medicines depends on what you're taking. If it's not absolutely necessary, then maybe you don't have to take it, but finding a way that to take the medication and in a safe and helpful way. And what I like to do is when I take my thyroid medicine, I say thank you. Another one that wonderful Dr. Lum told me to do, but it's like utilizing that, like this is helping me. And Abigail and we've talked about utilizing the power of the brain when taking medicine so that it can work to the even more effective capability. And that, I also tell myself I don't have to take this forever. That maybe one day my thyroid will balance out and it'll be okay. But right now this is helping me. And so that fear and that anxiety around medications and different things, I really, really resonate with. Like I said, I was on 19 pills. Now I only take one. But in between there, I was taking like 30 different supplements and just so afraid of everything. And so to me, it sounds like you are also in a state of heightened alert and fear. And so calming that down would be super helpful.
Amazing. So here's another one. Maybe I'll take. It's a little bit more kind of psychological. I have a question about acceptance. I don't want to accept that this would be my life, but there's a whole train of thought, especially in the psychological literature, about acceptance and commitment therapy, other ideas. How can I accept what I want to believe without going into denial, or I'm just fooling myself? So first of all, this is where having a really good diagnosis is important, because we want to be really careful that, yes, there's some realities we want to accept, right? If I have, just think about our last example, if I have an oncology, a cancer diagnosis, I do need to accept that that's where I am in the world and figure out how to move forward. But I want to know that I'm accepting the right thing. And so accepting I'm going to have pain forever, to us and to the medical community, is probably not the right place to do your accepting. Better place to do it is find out what's really going on. Find out if you have primary pain. If you do have primary pain, accept that and say, great, I have primary pain. Now I need to do the work to learn how to treat this disorder and to learn how to start to reverse it out. And that's a really great place to focus your acceptance, is when it leads you to something that's putting you on a pathway towards properly treating and recovering from this disease of chronic pain, chronic primary pain. how do you diagnose? New question. Hi, ladies. Thank you, Barbara. Just call out there. Wondering how you diagnose if pain is primary or not. So like any medical condition, primary pain has certain hallmark signals in the way it behaves. And so the kinds, I talked a little bit about some of the things we looked at in the example of that we're talking through earlier about somebody with a breast cancer survivor history. But there are a number of other factors also that go into ruling in a primary pain diagnosis. A lot of them have to do with the way your pain experience occurs. So the same way, like with diabetes, we want to do some detective work around how your body processes sugars. With pain, we want to do some detective work around how your neural circuits process pain signals. And so what we've built at Lynn is actually the first national network of primary care providers that are specifically trained to diagnose primary pain. This is a super new diagnosis. Like I said, just came out in January, and a super important one. But so it's pretty likely that most physicians aren't really trained and skilled at recognizing and diagnosing primary pain. So that's why we offer a diagnostic consultation, so that we can look at your pain presentation. And again, for each person, there will be kind of slightly different hallmarks, but really look for, does it have the hallmarks of this disorder? And when they're there, we're able to say, yep, primary pain is a part of your experience. Sometimes we're able to say, yep, primary pain is all of your experience. And sometimes we say, yep, there might be kind of both a primary component and some underlying piece, but that underlying piece would probably feel very manageable. That structural or secondary pain, we call it, piece would probably feel very manageable if we had the primary pain disorder under control. So we're going to kind of squeeze in one last question, and then our team's going to come back on and just give a little bit of end of a webinar follow-up information in terms of promotion codes and how to get a discount on a diagnostic assessment. If you want to, we would love to make that available for you. But kind of very last question, when will the medical community wake up and realize that more care for this kind of centralized pain and more care that is like centralized and all put together is better? How do we start a movement? We're doing it. You're being at this webinar today and starting that movement. Shannon, would love your thoughts too on how we're starting a movement here at Lynn.
Absolutely. I mean, it's all about the information that we have and that's available for people. And so I always talk about how I found this info on some small, strange corner of the internet. And now Lynn is now becoming a part of that and being a bigger voice for that. And so one of the ways that I have started sharing this information is I share things on my Instagram. I share things with friends and family, not so much because to each their own. And so, you want to share with people who are ready and open to hear it, but, just knowing that it's possible. And, I've shared it with past doctors that I've mentioned today, and they're so excited. And I feel like most of the medical community really wants to help and really wants to have a solution for their patients. And they have so much love and compassion, but they haven't been given a solution. And now this is a solution for so many things. And it's, what is it? Nothing is more something than an idea that its time has come. And the time has come for this. And it's really exciting to be on the forefront of that and helping, share this with the world.
And with that, I'm hoping our moderator can come back on. I'll share the code and then any other information too. So you'll get an email about this, but to get a $30 discount off of your a diagnostic consultation for primary pain, if you use the promo code APRWEB, APRWEB 30, when you register at Lynn, just following the links that you'll be getting, and that'll give you the discount. Again, it's APRWEB 30. And that's the end of our webinar, but Alyssa, if there's anything else I forgot to say, probably now's the time to hop on and share with folks.
Yeah, thank you so much for that incredible conversation. We will send the link in the chat. So I want you to see that. Hunter's sending those right now. There is a survey to fill out. It really helps us craft the next exciting webinar. We love feedback. And the link to sign up if you're interested in joining Lynn, as well as the promo code. So you can also reach out via phone. We would love to field your questions. Hunter will send our phone number. So sign up, check it out, and call us if you have questions. And any questions that we did not get to address live, we will reach out to you privately. So thank you so much for the great engagement, and we hope to see you next time.
And we will leave the channel open here for a few seconds if people have, for a couple minutes if people have other questions. Thanks so much for participating. Bye-bye.
Thank you, everyone.